This section talks to us about atrial fibrillation. Atrial fibrillation is an increasingly common problem in today's society. It basically consists of the back chamber of the heart going out of rhythm, leading to symptoms such as palpitations, shortness of breath, dizziness, possibly some chest discomfort. It's diagnosed on the basis of an irregular pulse, and treatment involves usually medication, but in more specialised cases, patients may be referred on for a specialised treatment called ablation of the heart, which involves burning a small amount of tissue at the back wall of the heart to cure the condition. Common causes of atrial fibrillation include high blood pressure or valvular heart disease, and sometimes it's associated with medical conditions such as an overactive thyroid.
I felt sort of strange in that I played a lot of sport in my and really had no problems with the heart, and no problems out of breath or anything like that. It was just this strange feeling, the beat of the heart just wasn't quite right, sort of thing. So yeah, I felt, what's happening here, sort of thing,
Atrial fibrillation is an increasingly common condition in the community. It's about 1% of the population around 50 years of age get it, and then every decade it doubles. So obviously, more 80-year-olds now, we're seeing a lot more people with atrial fibrillation. In some ways, it's probably even more, has more effect than, say, something like a heart attack, because often with a heart attack, if you survive it and you have medication or a stent, you go home and then your life, for a lot of people, gets back to normal. They're scared as anything by it, but on the other hand, it doesn't affect their quality of life going forward so much, unless they have a damaged heart, which is a different situation. But with atrial fibrillation, it tends to be a chronic type condition, so it goes on for years and years, often comes and goes, and it does make people significantly breathless and can make them dizzy and can make them feel fatigued. So it certainly leads to a lot of people feeling unwell for a long period of time. So, and it's controllable in the majority with medications. But having said that, the medications themselves can have side effects, and a lot of what we do as cardiologists is managing those issues of medications and side effects and trying to work out the best combination of pills for the individual patient.
I don't want to keep taking tablets. And so he suggested, well, there is a cardiologist in Adelaide that will help you if we could have a look at an ablation, and that could stop these irregular heartbeats.
And so that's consists of actually burning the tissue at the back of the heart, because we know from studies that have been done that most of atrial fibrillation comes from an excitable area of tissue around the pulmonary veins. There's 4 pulmonary veins that drain into the left atrium at the back of the heart. And we know that if you create an electrical boundary around those pulmonary veins by burning the tissue around those veins, sometimes with some other modifications, that you'll control, and probably 2/3 the first time round, you'll be able to cure their atrial fibrillation. So there's more research being done about different techniques, but essentially it's a pretty good operation. For most people, they get a good result first time round. And then, as I said, 2/3 each time you do it, 2/3 are successful. So if you have a second one, there's still a reasonable chance of success, as in John's case. And he was very happy that he had the second one done, and he's been very happy since then. He's got his life back to normal, which is what he wanted.
I'm interested in health and the body and everything about it, and I still read a lot about it. And so it was interesting to be on the other end, and you were the person on the other end of the operating table, if you like, And I've felt pretty good with the whole thing, and I'm really quite pleased that I went along the path of the ablation and did that to get off the tablets.
They got the ambulance in, and the people in the ambulance took us in and said I needed a pacemaker, actually.
People have rhythm disturbances, and they can be fast or slow. People generally understand that if the heart goes too slowly, people black out, and very slow hearts can be fixed with a pacemaker. A pacemaker is a device that's implanted under the skin, just below the collarbone, and this pacemaker can be implanted in the course of a 1-hour procedure under local anaesthetic with a bit of sedation. The person's home the next day. There is a lead from this pacemaker into the heart, and this pacemaker then provides backup rhythm if the heart slows down. The battery needs to be checked every 6 months and replaced every 7 to 10 years. So the person does have something implanted in them, but their heart doesn't ever go slow again.
I wasn't sure of the breath, well, which I had been, and my legs weren't aching so much, so basically I was a lot better, yes.
If the person gets a lethal rhythm, a very, very fast rhythm called ventricular fibrillation or ventricular tachycardia, this somewhat bigger device with leads attached inside the heart can give the patient an electric shock that suddenly brings the heart back into rhythm. Something that would have been lethal without this device, suddenly the patient realises something's happened, but they are alive. And we don't always find these devices are needed, because we sometimes put them in people who are at risk, but they never ever have a nasty rhythm. But there are a lot of lives that have been saved by these devices, and they really do make a difference in the people with sick hearts with nasty, nasty fast rhythms.